Ladies and gentlemen, I'm very happy and proud to welcome you to CIRSE 2020 Summit. That's a unique year, and we have planned and organized for you a unique meeting that you can enjoy. I'm very happy to have with me in my right side, Christoph Binkert, the Vice President of CIRSE, and in my left side, Kröncke, the SPC Chairman of this year, who has done the hard work to transform a face-to-face meeting to a virtual meeting. Thomas, tell us about this. How hard is what for you and for the CIRSE office?
Well, actually, it was a hard time for us to go from a live in-person meeting to a virtual meeting like this. But I think we are set. We have done a tremendous job, the whole team, the CIRSE office, with the help of all the participants, with the help of the SPC members, and all those who contribute now. So we will see about 420 live sessions within the next days. We will have more than 1,000 sessions on demand. So this is really a good thing, I think. We are set and we are looking forward to see you all there.
I have to say, when you are looking at the program and in the website, I was really impressed. You feel really being in a real meeting, and you can move from one room to the others, go to the workshop, go to the exhibits, talk to the industry, go in private room, talk with who you want to in private if you want. How about you, Chris? What is your impression?
You know, for me, the biggest thing is that after all this postponement, we finally have a meeting, or at least as close to meeting as possible in this 2020 year. I think it's great to really have spent time about education, connect with your friends, IR friends, and learn about the field which is moving on despite the difficult situation. So I'm great and happy that we have this Summit 2020 starting.
Thank you, Chris. We are very lucky to have 2 exhibition rooms with 40 booths and presence of the industry who have done a tremendous preparation for you. You can visit every booth, talk to the industry, participate to the program, ask them questions. It's a real meeting. Imagine yourself in the exhibition rooms, visiting, talking, going from one booth to the others. And finally, there is something new this year. We have 3 treasure hunts every day, and you can win for next year a grant to participate to CIRSE next year and travel grants. Go and chase the prizes.
The PAD Day is another highlight of the Summit 2020 from CIRSE. It covers the entire range of arterial interventions for a full day. The coordinator of that day is Professor Fanelli from Firenze. I'm very happy to have him here now to ask him a couple questions. Fabrizio, what is the highlight of the day in your opinion?
So last year, PAD was, in my opinion, a great success. Was a full day dedicated for peripheral arterial disease, and we had a lot of good feedbacks, not only from the participants, but also from different industries. And for this reason, we decided to do again the same format also this year in 2020. Where we increase a little bit also the interest of the different sessions. And again, we will have also the first at CIRSE, that you know is one of the major or most important part of this day.
Talking about first at CIRSE, I saw it's a wide range of new applications and new data. Is there anything you want to highlight about this session?
You know, this 2020 is a special year for, unfortunately, for many reasons. So also what is important that science doesn't stop. So we have a new data coming from the peripheral, but also very interesting data for the management of AV fistula that I think is another great portion of our daily activity.
And I see that you have split it up in CLI and claudication. Anything specific about claudication session you want to mention?
You know, we decided to split because, you know, that a patient claudicants are completely different from a patient with a CLI. So treatment options, management of those kind of patients are completely in a different way. What I can say you that the claudicants are the most, sometimes also more critical than a CLI because many of them are very young, and then we have to prevent reintervention. So now we have a lot of new devices and new technique available but it's very difficult sometimes to define which could be the best option for the patient.
The last 2 years were really bound to the problem with the drug-coated devices such as stents and balloons. I see in the program you bring answer to this. Can you elaborate on that a little bit more?
The big debate regarding the safety of drug elution is something now not more very cool. It's something that we already defined. There is no connection between the use of paclitaxel and the increased rate of mortality. What we are looking again that there is a sort of competition between drug-eluting stent and drug-eluting balloons, especially for complex lesions in long-term follow-up. But what is also very interesting that now we have some new devices with a different type of drug. And everyone is very interesting to see what could be the outcome using this different drug.
At the end of the PAD day, there is an innovative forum. What is new in the field?
There are a lot of new things. As I told you before, one of the most important is the possibility to use a drug-eluting balloon using something different from paclitaxel. But this session, I want to anticipate more to you because obviously this will be a big surprise for everyone. But you can find the new device and the new technologies that will be available for everyone in the next near future.
At the end, Fabrizio, what is your favorite part tomorrow? What are you thinking will be the highlight from the PAD day?
I think that from the first session to the last one, everything will be very interesting. So I hope that all the people can attend the entire meeting.
Fabrizio, thank you very much. This was Professor Fanelli from Florence.
Thank you.
Thank you. Bye-bye, guys.
Bye.
It's my great pleasure to introduce Alex Barnacle. She is the coordinator of the Women IR session. Alex, thanks you for joining. I would like to ask you some questions on that session. And, we experience that more and more women are willing to go into IR, but what can we expect from this session that you drafted?
Yeah, thank you for the opportunity to talk about it today, just ahead of the session later on this afternoon. It's great to be here and part of CIRSE this year. It's great to have the Women in IR session back on the agenda after Annabelle put together a great couple of sessions a couple of years ago. And I think, as you say, things have moved on. We're seeing perhaps more people joining IR. Certainly we're seeing that in the juniors showing an interest in CIRSE. But there's still a long way to go. And there are a lot of things that I think we can improve upon or that we can work on to make both our workplaces and our organizations more diverse and more attractive to females coming into the specialty. So we've got a really interesting session. I wanted to build it around women as leaders and role models. I wanted to look at women that I really look up to in the organization and within IR globally, and find out what it is about them, about their approach to their job, and their motivation that has made them so successful in what they do. So we've got Claire Bent from Bournemouth talking about how she got into IR and what her struggles were, as all of us face, men or women, coming into what is a really challenging and demanding specialty, what the highs and the lows of that were. And she's going to touch as well on the issues around pregnancy and how that can affect your training and just getting the work done as an IR. And then we've got Afshin talking about diversity in the workplace and how what an effect it has having a diverse workforce within your department and how that shapes the way that your organization works and is effective. We've got Maureen Coe from San Francisco talking about leadership. She is a fantastic role model within SIR and other organizations across in the States. And I'm really interested to hear what she's going to say about leadership. And she's going to talk about boss versus leader as a way of looking at leadership models and some of the skills that women in particular bring to that role. And finally, we're privileged to have Marie-France Giraud from Canada, who's going to talk about leading an organization organization, because although we may be introducing women into to train as IRs and to work as IRs, I'm really keen to see more and more women at the top and putting themselves forward for journals, for committees, for all of the organizational structure behind some of the departments and the committees, the organizations that we work in. That's just as important to see women at the top there.
Thank you. I would like to use a couple of minutes also to speak about pediatric interventional radiology. You are a very proponent of a prominent figure in pediatric interventional radiology. And we see more and more that people from general interventional radiology are doing these procedures. But what can they expect from the CIRSE program here? What can they take from that? What is highlighted here? What do you think is special to pediatric interventions that you want to address?
So I think we've got, again, some great pediatric IR in the program this year, and I'm really pleased that the Scientific Program Committee is really embracing pediatric IR as part of CIRSE. I think that pediatric IRs come from an interesting background, some of us from diagnostic radiology and some from adult interventional radiology, and we've got a lot to share. There are probably far more adult IRs doing some pediatric IR than we initially realize or are aware of. And so we've tried to build sessions to encourage those adult IRs to feel more confident in delivering some IR care for children when it's asked of them. And that is a whole range of things, what kind of kit is best for small children, issues around consent and aftercare. And of course, often the pathologies are really different as well. So some of the issues around delivering pediatric IR are not so much about the actual procedure, it's all of the information around the side, around the edges of it that are important. And I think just building relationships so that within CIRSE, we know who the pediatric IRs are within the society that we can reach out to, and who the adult IRs are who are interested in it and looking to grow it, because it's certainly something we really want to grow a lot more in Europe, and it's good to see so many more people interested in it.
Thank you, Alex. So it's my great pleasure to introduce Phil Haslam for the video learning session today. He's online right now, and I would like to ask you some question. Hey, Phil, how are you doing?
Great, thank you very much, and good morning to you, and thanks for asking me to speak this morning.
Well, my first question is, you are giving a talk on how to approach varicoceles from a transjugular approach. Maybe you could explain a little bit what to expect from this talk to those who might want to use this technique.
Okay, what I'd really like to show is, first of all, I like to make videos in real life, in real time. I do them with one of these GoPro cameras on the head, and I like to show the procedure as it really is. So there's very little editing involved. And I want to convey that to the doctors who are watching this, so you'll get an operator's point of view of how to do the procedure. I'd like to show how you do the jugular puncture. I'm going to explain how I use the local anesthetic, how patients don't mind this because we mix the anesthetic with bicarbonate to neutralize the acidity. And providing you then inject it slowly, patients really feel very, very little. So it's, as far as the patient's concerned, it's a very straightforward procedure. Most of the time, it's a very straightforward procedure for us to do as well. I think it's a great sort of case to teach registrars on, to teach the juniors on. It teaches them the fundamentals of a vascular puncture. It teaches them how to use angled catheters to select vessels that they want to go down. And more importantly, it teaches them how to steer a hydrophilic angled guide wire and actually to turn the guide wire in the direction they want it to go, rather than just randomly spinning the wire around and hoping it goes down the vessel they want. It also teaches them basics of embolization, of course, in a relatively safe environment. I think the consequences of a varicocele embolization going wrong are far less major than, say, you're doing an embolization of a pseudoaneurysm from supramesenteric artery or one of its branches. That's a completely different game altogether. So I think it's a great case. Most of the varicocele embolizations, left-sided ones, can be done in about 10 minutes. Sometimes they're a bit longer, of course. Of course, it also depends on who you're teaching how to do them.
So Phil, it's a special format, the video learning session, and we all expect a good interaction there. Could you explain a little bit what you expect there?
Yeah, well, these sessions are designed to be interactive, and it makes it much more exciting for the viewer, and even for me presenting to do this at CIRSE. So what we'll be doing is we'll be playing the video, and I'll be talking over the video, explaining what I'm doing during the procedure. But at the same time, be able to pause the video and stop it, and answer any questions that the audience might have or yourself might have along the way, and hopefully explain some of the finer points of the technique, and then be able to restart the video again. And I think once we've gone through the video, we'll then have the ability to have some interactive discussion with members of the audience and yourself, of course.
Thank you very much.
Thank you, Phil.
We're looking forward to it.
Bye. Thank you,
Bye-bye.
Phil.
Looking forward to it. Thank you very much, gentlemen.
Bye.
Bye-bye.
One of the highlights of CIRSE 2020 Summit this year will be on oncology. We are lucky to be in connection directly with Professor Thierry Debert from Institut Gustave Roussy. Bonjour Thierry.
Bonjour. Yes, I will be very happy to chair the session called IO Square. We will discuss about immuno-oncology and interventional oncology, and basically how we can collaborate for local immunodelivery. We are lucky to have a few European leaders in the field. And I think we will learn about rational techniques, ongoing studies, challenges. And importantly, this session has a very short format for presentation and a long time for discussion. And I think that IR should embrace IO for patient benefit and for benefit of the specialties. I think that as IR, we have the knowledge of drug delivery, and I think we can improve the drug delivery for immuno-oncology. And I think as radiologists, we have the knowledge of following up patients, and I'm sure that during this session, we'll discuss some specificity about follow-up, and namely a recent paper in Journal of Clinical Oncology, which is called IT RECIST for intratumoral RECIST. And I hope to see many people and to have a very interactive discussion.
Thank you, Thierry. We are really looking forward to hear this and to see this. Thank you.
It's my great pleasure to announce this year's winner of the Award of Excellence and Innovation in IR, Dr. Frédéric Deschamps from Institut de Cancérologie Gustave Roussy in France. And he will tell us now about his prestigious work. Dr. Deschamps, we are looking forward.
Hello Vienna, hello everyone. It's a great honor to receive the Award of Excellence 2020 for my work on percutaneous fixation by internal cemented screw in bone cancer patients. We have initially developed this technique because we were not totally satisfied with cementoplasty for the treatment of bone metastases in cancer patients. Indeed, a major inherent drawback of cementoplasty is the poor resistance to tension and torque stresses to which the pelvis and the proximal femur are often subjected in the course of daily activities. Furthermore, adequate cement consolidation of pathological fracture can be technically challenging, as multifocal or extensive cortical destruction can channel cement away from the zone of instability and result in suboptimal fracture filling or sometimes cement leakage outside of the bone. This consideration have prompted our interest in developing a new percutaneous approach for bone metastases located in the pelvis or in the proximal femur. And we named this new procedure FIX as fixation by internal cemented screw. The rationale of the metallic screws insertion was to improve the resistance to torque and tension stresses of cement augmentation. Many orthopedic surgeons have already begun exploring the utility of screw in non-pathological fracture. And despite the surgeon's technical experience, the percutaneous approach to pelvic fixation can be technically challenging for surgeons due to the variable shape, size and contour of the pelvic girdle. In addition, lytic tumor destruction of the bone may render a traditional fluoroscopic approach futile, as bony landmarks may be defaced. Advances in imaging guided technology have facilitated the possibility to perform screw fixation by the interventional radiologist. I have initially developed this technique for bone metastases located in the proximal femur, and we published the first series worldwide in CVIR, and then we demonstrated that better consolidation can be achieved with a percutaneous fixed compared to cementoplasty alone. Based on these promising results, we have then considered pelvic indication and published patient cohort. The first one was about palliation of pathological fracture in the pelvis, and the second one was about long-term consolidation of femoral neck metastases using screw and cement. I really enjoy the fact that this technique becomes more and more accepted by the IR community, and that this technique is now routinely performed in several cancer centers worldwide. However, orthopedic surgeons usually consider that they have to perform this technique now because they are legitimate and interventional radiologists are not. This is why I really believe that the higher community have to claim that we have a major role to play in this technique, because we have technical expertise, the anatomic knowledge, and the dedicated imaging guidance technology. So thank you again for this award, really an honor, and I really appreciate, and I look forward to seeing you, everyone, in the virtual next session rooms.
As you know, this year we are celebrating the 35th anniversary of CIRSE. If you want to, and I invite you to visit our website, cirse.org/35 years. You will see and visit all the past, the beautiful pictures, the memories, and people who met together. And we are lucky this year to have nearly all of our past presidents joining us to celebrate this 35th anniversary.
Happy birthday, CIRSE.
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 Happy birthday, CIRSE. Have a great Congress.
Cheers.
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 Birthday.